And welcome to Smiles by Mary. I'm Pat Dewar. Today's show is going to be unique for the viewers because it's a frequently asked questions show. The host of the show is Dr. Mary Swift. She is the 2011, 2012, 2013 Consumer Choice Award winner for cosmetic dentistry in the Dallas-Fort Worth area. For those of you that are her clients, for those of you that want to be her clients, which hopefully is everybody else, you will enjoy the show because we really want to cover the questions that you probably already have in your mind. The questions that are really about cosmetic dentistry, about regular dentistry. Is there a big difference? Is it something that everybody should be a part of? Who should qualify? What are the requirements of some of these things? You'll enjoy today's show. Thank you, Dr. Mary, for being on the show again.
Thanks for having me.
Well, it's your show, so I want to get into the whole idea behind cosmetic dentistry versus regular dentistry. Is there a difference?
I always feel there shouldn't be. My hope is that every dentist out there is putting only nice things in people's mouths. That being said, there are procedures that are specifically cosmetic. They're designed only to improve a smile. And when you do, like anything, more of those procedures or tasks, you get better and better at them. So someone who calls themselves a cosmetic dentist probably has an emphasis in their practice on the way the smile outcome appears, as opposed to just how it functions, if that says it well enough.
I think so. And what I'm hearing is that they've done enough dentistry and they've handled enough cases that they have the results.
They get good at it.
Yeah.
Yes. And in some areas of the country, you'll find dentists still putting silver fillings in teeth. I don't consider that a cosmetic procedure at all.
Right.
I haven't had any silver alloy in my practice since I graduated dental school. I think was the last time I put a silver filling in anyone's mouth. They're good fillings. That we have a longer history with them than we do with tooth-colored filling materials, but they're not very pretty.
Right.
So that would be a difference. A general dentist might still put silver fillings in. A cosmetic dentist probably doesn't even have any in the office.
Interesting.
But it's not a recognized specialty like a oral surgeon or a periodontist or an endodontist. Those are different specialties in dentistry. So a cosmetic dentist is not a recognized specialty, but if you do enough of it and your emphasis in your practice is on cosmetics, you call yourself a cosmetic dentist.
What are examples of cosmetic dentistry?
Mm-hmm. That basic silver versus white filling. Okay, a cosmetic dentist. That's a very basic. Smile design. Someone who is a cosmetic dentist will follow some very measurable principles of design that not just starts here but takes the whole face into consideration, gets every aspect of the face proportionate to the smile, or vice versa, the smile proportionate to the face, and makes things blend in and improve the look and the patient's confidence.
When I look at some of the notes that we prepared, I mean, I see things like teeth whitening, contouring, both shaping, gum some of these things, when I look at those, are those considered all cosmetic?
Cosmetic procedures, yes. Teeth whitening is cosmetic, absolutely. No one's health is improved by whitening their teeth. I could argue that. If you feel better about yourself, you know, same thing as exercising and eating right. But teeth whitening, and that's probably the most asked for cosmetic procedure. I believe it is statistically the most asked for cosmetic procedure. And there are different ways to whiten. A general dentist who maybe dabbles in a little bit of improving a patient's appearance probably would still do some whitening. Probably still just the patient take-home trays. In my practice, we have a laser technology to help activate the bleach to allow the patient to leave the office whiter than they were when they came in, as opposed to take-home trays, which are good too, but you have to wear them nightly for a prolonged period of time to get the same results as you do with a laser.
Well, and the cool thing about even your stuff, because I went through that laser, and the thing that was so amazing is how they continue to get brighter the more that you continue to use them. So yeah, and it really was pretty dramatic, the difference between what they were to where they are.
Isn't it fun?
It is, it is. Now, real quickly, some of the things I see here are bonding, bridges, veneers, dental implants, tooth coloring, smile makeover. You mentioned a little bit of that. Those are all in that envelope, aren't they?
Yes, they are. Yes, they are. And I usually get the new patient question. The most commonly asked question is, I want a smile makeover, what should I do? And that's where you start the analysis, basically.
Very good, very good. Well, folks, Smiles by Mary is really about giving you good information, tools, tips, techniques of brightening your smile, making it more of what you really want it to be. Dr. Mary has a long track record of performing way above the norm. We've got more to come. We'll be right back.
Staying involved in dentistry on every level, local, state, and national, makes me a better dentist. Our patients are our life and our livelihood, and we appreciate every single patient that walks in that door. And these are our family, and we treat them that way.